Hi, everybody. This is Patricia Scott with UP Hypnosis Institute. And tonight I'm going to talk with you about mindfulness, meditation, or hypnosis, how they compare. And they compare a lot more than a lot of people might think, depending on what area of practice you're from or what area of belief systems or information that you've gotten throughout your life, whether you're a professional or whether you're someone that has just studied these types of things. You're going to find that there are a lot of similarities. I say all the time that there's nothing new when I teach my hypnosis and medical hypnosis NLP classes. There's really nothing new. We keep repackaging things that we learned centuries ago, giving them some new cool labels, especially in modern day history. And the more that you can put something on it. I used to be a songwriter in my previous life, a singer and songwriter. I was in show business, and we used to talk about the hook. You have to have the hook. You have to have something to get someone's attention. So it's important that we have these labels, these attention getters, if you will. The word hypnosis got some kind of negative attention for a long time. When I came into it 28 years ago, I basically had a very good impression of what hypnosis was. I had been reading about it for 20 years while I was in show business and using it for a myriad of amazing things that literally changed my life in ways that when I did discover it was hypnosis, that pretty much what I was learning to do, that it really did open up a whole new world to me. And then 28 years ago, I became a hypnotherapist, and the rest is my second life history, recent history. So let's talk a little bit. I'm going to cover this fairly quickly, but let's talk about mindfulness first. This is, I'm going to call it a fairly recent buzzword, if you will, and I mean that respectfully, again, because you got to have that hook. And mindfulness is something that's fairly new. The definition from Psychology Today is that it's a state of active, open attention to the present. This state encompasses observing one's thoughts and feelings without judging them as bad or good. Now, this is a great thing. Now, coming from the world of hypnosis, hypnotherapy, and neurolinguistic programming, which is what NLP is, in case you didn't know that, there are a lot of presuppositions, we call them, when you come into the world of NLP. And to me, they enhance what I have been doing all these years in hypnosis to the nth degree. They bring all of the techniques and processes that I learned as a hypnotist and took them up another quantum level, I like to say. Make them much, much more effective, much faster to get results with, because hypnosis and NLP, one of the things I do love about this field is it's results oriented. It's all about what is the outcome you're looking for, what are the current obstacles to getting that outcome, and how can you overcome, get past, eliminate those obstacles in a way that are healthy and best for the client that's sitting in front of us as the hypnotist. So NLP, I think, is the presuppositions of NLP are everyone's perfect, everyone works perfectly. That's always kind of funny when people first hear it. But what it means is that based on all of our past experience and the way we've reacted to it, our current and past beliefs and expectations, values, and what consciously and unconsciously we have done and thought regarding things that have happened to us produced this perfect outcome within those parameters. Now, and then the other part of it is, if you want a different outcome, then you have to change something. And that's what all of these fields of study have been trying to figure out for centuries. And we're still, I'm sure we will forever, which makes it exciting and interesting because we keep coming up with new ways to do things. And that's a good thing. So to live mindfully, they say, is to live in the moment. By the way, a lot of this comes from Psychology Today, so some of you may be very familiar with this. Living in the moment and reawakening oneself to the present rather than dwelling on the past or anticipating the future. Mindfulness can always also be a healthy way to identify and manage latent emotions that are causing problems in personal and professional relationships. Okay, so that's good, right? Now there's another area of mindfulness now that's called mindfulness-based cognitive therapy. We all know about cognitive behavioral therapy, right? CBT. Now we have mindfulness-based cognitive therapy, again, a new packaging, and it's MBCT. So if you look into that, again, a lot of the same variables, a lot of similarities to hypnosis, being in the moment with hypnosis. I have a clock that I used to have when I did all my trainings in my old office. And the clock, instead of numbers, it had the word now in all of the positions where numbers would be. And I love that clock because, again, mindfulness kind of, again, is similar to hypnosis in this way. It's all about what's happening right now. What are your responses? What are your feelings? What are you experiencing physically, mentally, emotionally right now? And what would you prefer to experience moving forward? And how, again, can we figure out a way to change some of your strategies internally, some of your thought processes, some of your habits of thinking and behaving and acting and reacting, so that you can start to train in enough difference to have different outcomes, to have create a new future, if you will, moving forward. So mindfulness-based cognitive therapy is, again, another level. I think they took the mindfulness to that next level and incorporated some of the things they'd learned from cognitive behavioral therapy. And here you are. And again, when I read about these things, there is so much similar to my field of study, which makes sense because hypnotherapy, we study psychology, we study the mind-body medicine type model and all of these things, which is always changing and evolving. So, when I read some things on one website that were kind of cool because they have these little processes you can do with mindfulness. And it reminded me again a lot of hypnosis. You'll see why if you're a hypnotist. So here's your morning mindful routine. Here's a suggestion. An example: upon waking, you might take several minutes to notice how your breath is coming into the day. Take a few slow and deep breaths and notice your senses starting to engage. Your sense of smell, your eyes adjusting to the morning light, the suggestion of your body against the sheets, and the morning sounds of the world waking up around you. Once you have experienced these sensations, you might add some light stretches or wrist rolls. Notice the energy starting to flow. Maybe you're not a morning person, so this is a great way to ease into it. Now that's a little exercise from a mindfulness site. Sounds a lot like the beginning maybe of a hypnosis session, doesn't it? So a lot of similarities, more similarities than not. And by the way, Michael Yapko has said that there are a lot more, it's more alike than not. I'm going to show a little short video of Michael Yapko because he is kind of my new go-to person because he is from the world of psychology, but he is an amazing ambassador and advocate for hypnosis. And he has a new book, which I just found out. Well, I don't know if it's new, but it's one that I hadn't noticed before. And I'm going to see if I can share this with you because I'd like you to see just a couple of minutes here of Michael Yapko.
Hi, I'm Dr. Michael Yapko, clinical psychologist. And I want to talk to you today about my newest book. It's called Mindfulness and Hypnosis, The Power of Suggestion to Transform Experience. I've been studying hypnosis now for nearly 35 years. It has been a big part of my professional life. I've been so intrigued by people's ability to respond to suggestions in all kinds of meaningful ways and dramatic ways. Recently, over the last few years, I've been particularly interested in the phenomenon of mindfulness. And mindfulness has attained a level of popularity amongst therapists already that in some ways hypnosis can only envy. But when I came to mindfulness, I was so curious about the kinds of guided meditations that practitioners were using with their clients to reduce anxiety, reduce depression, reduce pain. And so I was really interested in what do mindfulness experiences actually provide? How are they structured? And so bringing my hypnosis background to the phenomenon of mindfulness, I was able to, in essence, strip away the spirituality, strip away the global philosophy, and really just analyze what is it that people actually say and do when they're conducting guided mindful meditations. And so the result is this book, looking at the role of suggestion, describing the social factors and cognitive factors that influence people's ability to respond to experiential processes in general, and experiential processes like hypnosis and mindfulness in particular. If you take the time to read the book, what you'll learn is how powerful an overlap and how broad an overlap there is between the practice of mindfulness and the practice of hypnosis. Both of them involve the use of attention. Both of them use suggestions to facilitate powerful subjective experiences and to be able to essentially pick apart what mindfulness does and how it does it with the insights that are gleaned from the semantics of hypnosis, the neuroscience of hypnosis, I think makes for a very powerful contribution in better understanding how we can use mindfulness, tailor mindfulness approaches to the needs of the individual rather than just following some scripts. And so I describe many of the paradoxes associated with both the practice of hypnosis and mindfulness. I talk about different ways of using mindfulness creatively beyond some of the ways that people have been using it to help create better therapeutic outcomes. I'm excited about the book. I hope you will be too. Thanks a lot for listening.
So let's continue on here because I want to get into talking a little bit about meditation. Some of you, if you're as old as I am, you may remember TM from the 60s and 70s, Transcendental Meditation. What a cool thing that was. And I'm going to give just Wikipedia's definition, first of all, to kick this off, of what meditation is. Meditation is a practice where an individual uses a technique such as mindfulness, there's that word again, or focuses the mind on a particular object, thought, or activity to train attention and awareness and to achieve a mentally clear and emotionally calm and stable state. Scholars have found meditation difficult to define as practices both vary between traditions and within them, much like hypnosis. The Chopra Center, of course, Deepak Chopra, who knows a lot about meditation, has written a lot of books also. He says meditation can remove stress and replace it with a dose of inner peace. But it can be tough to meditate without a teacher or a guide. Guided meditations literally walk you through a meditation and walk you through a meditation and help to find a calm and peaceful state one step at a time. So another thing, transcendental meditation then I talked about, it's a technique for detaching oneself from anxiety and promoting harmony and self-realization by meditation, repetition of a mantra, and other yogic practices. Promulgated by an international organization founded by the Indian guru, of course, Maharishi Mahesh Yogi. And that was around 1911. So, transcendental meditation refers to a specific form of silent mantra meditation, and less commonly to the organizations that constitute the transcendental meditation movement. Maharishi Mahesh Yogi created and introduced the TM technique and TM movement in India in the mid-50s. Again, if you're from the 60s, 70s, I was born in the early 50s. Now you know how old I am. So I remember a lot about Maharishi Yogi and transcendental meditation. So that, I think, was kind of a precursor to all of these different styles and types of things coming together in recent history in the last 20 years or so to really form a nice well-rounded way for us to access human behavior and change things that we would like to change about ourselves. So now I'm going to talk about hypnosis, obviously, because hypnosis is my particular field. And the Mayo Clinic is a great proponent for hypnosis. They say hypnosis, also referred to as hypnotherapy or hypnotic suggestion, is a trance-like state in which you have heightened focus and concentration. Hypnosis is usually done with the help of a therapist using verbal repetition and mental images. When you're under hypnosis, you usually feel calm and relaxed and are more open to suggestions. There's that word under hypnosis. Everybody says, you're going to put me under. I prefer the word into hypnosis. And I go into hypnosis, I help to guide someone into themselves to form this state. My own definition, which isn't written down specifically, that I repeat a little differently each time, but I think of it as a concentrated, focused state of attention in this moment. Mindfulness sounds like there, doesn't it? In this moment, to the exclusion of the peripheral distractions that would interfere with your best possible outcome from what you do right now. So that's, and again, I don't say it the same way every time, but that's my basic idea of what I think of hypnosis being. Now, that doesn't mean the practice of putting someone into a hypnotic state, guiding them into that and helping them to discover things and change things and all of that. That's exactly that. Because that, the process of doing a hypnosis session is a whole lot more complex and has a whole lot more about that. But the basic state of hypnosis is just, to me, that. So what can hypnosis be used for? Again, the Mayo Clinic, it can be used to help you gain control over undesired behaviors or to help you cope better with anxiety or pain. It's important to know that although you're more open to suggestion during hypnosis, you don't lose control over your behavior. Now, my specialty since I started in hypnosis 28 years ago is medical hypnotherapy, and I train people now. We've got a training starting June 6th, I think it is, 2020, in the medical hypnotherapy specialty training that I created and is still evolving through the years. That is now approved through the International Medical and Dental Hypnotherapy Association. So medical hypnosis, there's a lot, anxiety, stress, if you will, is a part of all physical ailments. And I have tended to believe through the years, and I think a lot of people agree with me, that at the core of a lot of physical and emotional problems people have is some stressor that either happened one time or has been experienced repetitively through their life that has not been resolved, they haven't found a healthy strategy to deal with it. And that's what I think hypnosis helps with. So back to what the Mayo Clinic says hypnosis is good for: pain control. Hypnosis may help with pain due to burns, cancer, childbirth, irritable bowel syndrome, fibromyalgia, joint problems, dental procedures, and headaches. People that know me know I've done for 20 or more years now. All of my dental procedures have been done with zero anesthesia, zero numbing, and zero pain medication. And that includes last year, the biggest thing I did, maybe 2 years ago now, I had oral surgery on the whole top of my mouth. I had 2 bone grafts, several sessions this took, and 7 crowns put on the top. Now that was quite a step beyond what I had done in the past. Totally did it with zero anesthesia, zero numbing agent, and I didn't even fill the prescription for pain medication when I left. And honestly, it was quite remarkable. So the mind is powerful. Okay, also Mayo Clinic says can be used for hot flashes. Hypnosis may relieve symptoms of hot flashes associated with menopause. Behavior change, of course, we all know that. Things like insomnia, smoking, overeating, bedwetting, nail biting, all of those kinds of things. Cancer treatment side effects. This is very well known in the medical community that hypnosis is great for alleviating the side effects of chemotherapy. Hypnosis has been used to ease side effects related to chemotherapy or radiation treatment, is what the Mayo Clinic says. They also say mental health conditions. Hypnosis may help treat symptoms of anxiety, phobias, and post-traumatic stress. Now, again, those of us in the hypnosis world know that it's phenomenal for all of the above. Matter of fact, tomorrow night, I'm doing a very inexpensive webinar on, I forget the exact words, name I put on it, stress, anxiety, and PTSD. I think it's anxiety, panic, and PTSD. So we'll be talking more about those things in relation to how we can help with the mind and the hypnosis techniques. So Psychology Today, back in 2001, I have this sheet that I like to give out when I give talks. 2001 this was, okay. And some of these studies they cite are from well before that. So they talk about hypnosis for surgery. And hypnosis given during surgical radiology not only diminishes patients' pain and anxiety, but also shortens surgical time and reduces complications from the procedure. That was reported in the Lancet in 2000. Now I know when I do my dental work with hypnosis, it takes way shorter. Every single time I've done it with a dentist, and I've had a few through the years, the first thing they say when we're done is, that was so fast. They always look at their watch and they say, I've got a few minutes till my next client, because it does. And the surgery that I had was even more phenomenally cut short because of little complications and having to pause or stop during the treatments and those kind of things. That didn't happen, and generally doesn't. Everybody's different, of course, but for me, it's been really amazing. Okay, cancer. Many cancer patients suffer nausea and vomiting, not only after chemotherapy, but before treatment. Again, that anxiety, that thinking about it ahead of time so many times is the biggest part of it. In a study of 16 subjects who normally experience these symptoms, hypnosis alleviated pre-chemotherapy sickness in all of them. And that's just one little study from Oncology in the year 2000. Immunity. Hypnosis seems to significantly raise the activity of B cells and T cells, both key to immune response in highly hypnotizable subjects. And this was reported in the American Journal of Clinical Hypnosis in 1995. Now, I know since then, there are multiple studies and a lot larger studies on all these things. I just like this one because it shows even way back in 2001, we knew that hypnosis was good for all these things. The one that I like the best on here, I'll move to, is hypnosis for attention deficit disorder. And this is from a report that was presented at the American Psychological Association meeting in 1999. So they had the ADD back then. I don't think they even had coined the term ADHD at that point. And what they reported at that meeting of the American Psychological Association is that research shows that hypnosis is as effective as Ritalin in treating ADD in children. Now, I always ask my students, I say, have you seen that in the headlines of the newspapers in the last 30 years, whatever it's been? I don't think so. So here you go. So I wanted to read a little piece that I like to give out of Bruce Lipton here. Okay, I think you can see that now. Actually, there's two things on here. Bruce Lipton, he has a book called Biology of Belief. And here's just a little short paragraph out of that book. Our new understanding of the universe's mechanics shows us how the physical body can be affected by the immaterial mind. Thoughts, the mind's energy, directly influence how the physical brain controls the body's physiology. Thought energy can activate or inhibit the cell's function, producing proteins via the mechanics of constructive and destructive interference. And Martin Rossman, from an MD, from Fighting Cancer from Within, some of you may be familiar with that wonderful book. He says, imagery has been shown in numerous research studies to affect almost all major physiologic control systems of the body, including breathing, heart rate, blood pressure, metabolic rates, digestive functions, sexual functions, and perhaps most important, immune system response. Think about what's going on right now. Here we have this coronavirus thing going on with the immune system. A review of articles, this is again from Rossman in Fighting Cancer from Within. A review of articles investigating whether imagery could affect immune response revealed that the vast majority of 22 such studies showed significant positive results. They demonstrated that people doing imagery aimed at stimulating the immune response against cancer or chronic viral illnesses increased not only the numbers of circulating killer cells, that's the immune cells specifically charged with eliminating cancer cells, but increased their aggressiveness when encountering an abnormal cell or virus. The level to which immune response is increased with imagery is significant. When the system is stimulated by imagery, there are no adverse side effects. Any side effects actually tend to be positive, a greater sense of calmness, empowerment, and feelings of wholeness. And all the references are on there. So there you go. Okay. So again, I always talk about in my training, my hypnosis trainings, that the more emotion that you can get into the visualizations, the more real, the more you can incorporate all of the senses into what you're guiding that person to, the more powerful it becomes in the body. Again, because the cells and every internal function of the body is listening and paying attention and reacting to instantly every thought you think. And the more vividly people can create in their imagination these things for healing and health, the more the body tends to respond without having to be a doctor and knowing what those inner mechanics are, because we've been doing this since before many things were even discovered, or we had the great instruments to be able to look inside the body or scan the brain to see what's happening. It was still working even before we began to understand it a little bit better. So that's some of the things I wanted to say about all of that. With hypnosis, again, to me, it brings it all together. It has elements of all of the great things we've discovered up to this point in history, in my opinion, And so if you're wanting to learn anything about hypnosis, again, I've got hypnosis certification training starting May 30th, 2020. And we have the, right now we're doing everything virtual online. It's been approved until all of this stuff's over that we're going to be able to train online. And frankly, I was averse to that for a long time. And I've been doing a lot more of it lately, and I'm really kind of jazzed about it now. I'm excited because I'm finding that you still get that same interaction. You still get that closeness, even though it's on a computer. The rapport can still be there when you're working with clients. And in teaching, it's been really exciting because I can get people from all over the world. And you can go to uphypnosis.com to sign up for, or if it's past this time when you watch this video, you can go on there and see what we're doing, because we're always doing hypnosis training, NLP training, medical hypnosis, parts therapy, timeline, all different types of processes that are related to all the things we talked about today. So hopefully this gave you a little bit of more of an understanding. I always like to pique people's interest so that you can go out and maybe discover some things on your own, and send me what you find. If it's something interesting I haven't seen yet, I'd love to see it. So again, Patricia Scott here with UP Hypnosis Institute, and you can go to uphypnosis.com and check out all the different classes. I still see clients privately right now. I'm doing them online on Zoom, and hopefully soon I'll be able to start doing in person again. So take care, and remember to think up. That's my motto, think up. I guess I could do a transcendental meditation to that mantra. Think up, think up, think up.